This is Dr. Ann Bass of Hospital for Special Surgery, and I'm speaking to you about my JBJS article, Periprosthetic Joint Infection is Associated with an Increased Risk of Venous Thromboembolism Following Revision Total Knee Replacement, an analysis of administrative discharge data. So this study began when a group of us were discussing unmet needs in the area of prosthetic joint infections and avenues for future research, and my colleague and co-author Peter Skolko mentioned that he had recently cared for a patient with prosthetic joint infection who had a DVT after a revision surgery. And he wondered whether this was a problem that was typically associated with prosthetic joint infections. And I knew as an internist that infection, in fact, does increase the risk of VTE in other contexts. But we did a quick literature search and realized that this had really never been studied in the context of orthopedic surgery. So at first we wondered if we could use our arthroplasty registry to study the question, but even though we have about 6,000 patients in that registry, we knew we would be underpowered for VTE as an outcome. But at the time, I was working on another project using a large New York statewide administrative database, looking actually at racial disparities in the risk of septic and aseptic revision knee replacement. So we had already amassed a very large data set that included over 25,000 patients who had undergone revision knee replacement, and among them, 17,000 had aseptic revisions, over 7,000 septic revisions, and then there were 800 who had revision surgery done because of periprosthetic fractures. And we realized all we needed to do was to look at 90-day readmissions in these patients for VTE to be able to compare the rates in the three groups. And what we found was that both septic revisions and fracture-related revisions were associated with a greater than twice the risk of VTE compared to aseptic revision knee replacement. And the nice thing about this study is that everyone in the study, all of the patients, had revision surgery, so we were able to control for the risk of VTE that's associated with surgery itself. Now, of course, patients with prosthetic joint infections have more comorbidities, but we did multivariable logistic regression analysis, and the risk that I quoted, more than twice the rate of aseptic revision, is after controlling for these factors. So the bottom line is that if patients are admitted for revision surgery due to prosthetic joint infection or fracture, those factors should be considered when you're risk stratifying them for VTE prophylaxis.